Well, hello, everyone. We're here again today to update you on the city's response to the COVID-19 pandemic crisis. I can assure you that there's a team of people working 7 days a week to help keep our community safe. But there's some new news and some good news to tell you about today. First of all, the CDC, the Center for Disease Control, has a foundation, a nonprofit arm, and they're agreeing with the city to enable us to hire 4 additional employees for our public health department who will help us fight the COVID-19 virus. They will help us in terms of emergency management and on the public health side. So we're very happy to be able to work with the CDC, the Center for Disease Control, and their foundation. And we're going to be very happy to have these locally hired people here in Nashua to help public health and emergency management with our response. But I wanted to tell you about, of course, the approach that we're taking towards fighting the virus. We are, of course, cooperating with the state of New Hampshire, with the governor in terms of the orders that the governor has issued regarding the operation or the closing of businesses. But we are following a procedure which we can refer to as TTI. This means test, then track, and then isolate. Test, trace, isolate. And what this means is the first thing that needs to be done is wider testing, as much testing as we possibly can get. And we are working with the state of New Hampshire to make that possible. The governor speaks with me and other mayors around the city periodically, and they are intending to increase the testing to 1,500, as many as 1,500 people per day. So that's the testing part of our approach. The next thing is tracing. We need, and this is what we're doing with our public health nurses, and I want to thank them for all of the efforts that they're putting in, is that anyone who does test positive, our public health department has to trace them, meaning trace all of the contacts that patient, that person who's tested positive, has had over a period of time before their symptoms became apparent, so that we can try to locate everyone else who might have been associated or come in contact with this person who has the virus. That is a very vigorous exercise, and that is what our public health nurses are involved in now. Then isolate. We want to isolate each person who has either come in contact with a positive case, with a person with the virus, and all of the family members and others who might have contracted the virus from a positive case. So we're using this TTI methodology. This is the way we're trying to isolate this disease. Another way of expressing it is what you see on the screen right now. This is a slide that was generated by Bloomberg Philanthropies and has been circulated to the mayors around the country. And what it does is it reinforces what we've already said. We're trying to box in the disease. We test widely. We isolate all the infected people. We find, this is the tracing part, we find everyone who has been in contact with infected patients, and then we isolate. We quarantine all contacts for 14 days. Now, in terms of the status of the situation here in Nashua, we have about, and you'll hear more about this from Public Health Director Bobby Bagley, but we have 150 cases approximately that have been identified in Nashua. Now, most of those people have recovered. Unfortunately, we've had 8 people die, and we now have about 50 active cases. And our health department, our public health nurses, are tracing the contacts of about 110 contacts that our 50 active cases have had in the time before they contracted the virus. Another thing, but this is relatively good news. We've been able to limit the number of cases in Nashua to 150 so far. keeping our fingers crossed. But if we look over the border down in Lowell, a city a little bigger than Nashua, but not that much, they have over 1,300 cases as compared with our 150. So almost 10 times as many. And their hospitals are really almost at capacity. They can't, if they get a lot more COVID-19 patients, they're not going to be able to handle them in their hospital. Whereas right now, our hospitals are in good shape. We have, of course, Southern New Hampshire and St. Joe's. Together, they have about 15 inpatients that are being treated for COVID-19. Also, they're watching about another 20 or so people that have been tested, have symptoms, and it's not yet determined whether they have the virus. Some other good news in Nashua is that our public health department over the last 2 days, and you'll hear more about this from Bobby Bagley, was able to test 150 people right here in the city. And this is something we worked with the State Department of Health and Human Services to accomplish this. And this is something that will be continued in the future and expanded so that we continue to try to test as many people as we possibly can. In order to eventually reopen the city and reopen the economy, we need to know how many people have the virus, how many people may have gotten. There've been some random tests in both California and New York where there are more patients certainly than we have here in New Hampshire. And both of those tests, those random tests, have shown that some percentage of the population out there may have the virus and have no symptoms. In other words, they call that asymptomatic. In New York, it was 13% of the people tested, and several thousand tests were done statewide. 13% had the virus without knowing it. Now, we know the outbreak is much more serious than in New York than here, but we just can look at that as an example of what might be true, especially in Massachusetts and to some degree in New Hampshire. We are beginning to work on how we might begin to recover once the coronavirus has passed. We don't know when we might be able to reopen things. We are, of course, following the instructions and the guidance of the state, the governor, and DHHS on this. But we have assembled a COVID-19 impact fund, which is some sources of federal money we put together. The city has to provide small business loans to many of the small businesses that are really struggling right now. This would be $1.2 million, and we expect our loans would be in the $25,000 range. We want to help the businesses that have been struggling reopen and survive and prosper once we get to that point. In addition to this, I wanted to tell you about some of the efforts that United Way, and let's go to the next slide. United Way and many volunteers are undertaking here in the community, and it's been a fantastic Team Nashua effort. The United Way has assembled volunteers, and Nashua Transit, the bus system, is working with them on this, and they are distributing, this shows you how many meals per week, but thousands of meals per week, both breakfast and lunch, to the kids in the city who ordinarily get free lunch and breakfast at school because their families have trouble affording those meals. So we have delivered this volunteer effort with the transit company, has delivered 40,000 meals, at least more than 40,000 meals in the weeks that the schools have been closed. So I want to thank them for all their effort. And before I turn this you over to our next person, Bobby Bagley from Public Health, I wanted to just again thank everyone who's involved in this effort. Bobby and everybody, our public health nurses. You're going to hear from Justin Cates, who is the emergency management director, people at City Hall, our fire, our police departments, our hospitals, our hospital workers. Everyone is pitching in this Team Nashua effort to try to keep our community as safe as we possibly can, and to allow us to contain the spread of this infection, this virus, as much as possible. So I want to thank everybody again for all of their efforts. I'm just very proud of everyone who's been involved. I'm proud of our entire city for what we together have been able to accomplish. So with that, we will be back in a week or so to update you again. But I would like to turn you over, please, to Bobby Bagley, Director of Public Health.
Thank you, Mayor, and good afternoon. My name is Bobby Bagley, and I'm the Director for the Division of Public Health and Community Services. And I wanted to share with you some of the data or the numbers that we have been looking at on a daily basis as we meet with our hospital and our joint partners, as well as with our city division directors and stakeholders. So this slide just shows what we've been seeing as far as this pandemic event continues to evolve. So globally, you can see that there's over 2.7 million cases worldwide, with over 191,000 deaths. And in the United States, we're up to 869,172 cases, with over 49,000 deaths. And so we can see that the virus continues to spread across the globe and the United States. And then here in New Hampshire, we've had 1,670 cases reported as of this morning, with a recovery rate of 33%, which is really important, and a hospitalization rate of 13%, which is even a more important number for us to understand where we are right now in this event in our state. 3% have died, and although that percentage may seem like it's a small number, it's still significant because those are loved ones that have been lost unexpectedly in the time of this event. Some of the mitigation measures that we put in place have allowed for us to see these numbers remain at this low percentage, and we're hoping that these will remain and stay the same. In Hillsborough County, we've seen over 721 cases, and I say over because right now it's afternoon and we got these numbers reported out to us this morning, and we've experienced 30 deaths in our county. In Nashua, we've investigated, or we've seen 151 cases cumulative. So we've investigated all of those cases. Currently, we have 50 active cases, and we have 109 contacts that we are tracing, tracking, and providing information and education to. And a part of that tracking and tracing allows for us to get out information around quarantine and isolation. And those, again, are very important measures to slow the spread of this infection. We've taken a very proactive and aggressive approach at contacting individuals and identifying who has been exposed to coronavirus so that we can know again and stop the spread of this infection by asking those individuals and imploring those individuals to make sure that they use the quarantine methods that are in place. And that means not going out, staying at home, and limiting their exposure to others, even in their own homes, and especially in the community. We've experienced 8 deaths in Nashua, 7 of which have been in our long-term care facility. The reason why our efforts are so aggressive is because we know that there are very vulnerable populations that are impacted by this disease that can even die because of either their age or because of other underlying health conditions. We also have some good news in that 56% of the cases that we have investigated have recovered. This slide here just shows a comparison between Nashua with Hillsborough County and New Hampshire. And you can see Nashua, if you look at our percentage rate here on this slide, it looks like we're just a little underneath the Hillsborough rate, but we're trending above the New Hampshire rate of cases per 1,000 people. And that is why we take the measures that we do to try and slow the spread of this infection. And as the mayor mentioned, having this all on board team approach, it takes the whole village, it takes all of us to do what we can to stop the spread of this infection and slow this disease down. Next slide, please. Some of the other things that are very important for us and the measures that we're going to take in New Hampshire, and even aligning with what the governor wants to see. You've seen our percentage rate for cases. You've seen the percentage rate for our deaths in our region in Hillsborough County and also in the city of Nashua. One of the things that we really need to do is we need to increase our testing rates. And this slide here just shows the number of tests that have been completed, as well as the number of negative tests and the negative positive tests on this slide. We know that we have to increase our testing rate, and we actually have the capacity to do so going forward. As the mayor mentioned, we had the opportunity to have 2 dates of community testing in which we tested 150 individuals that represented very diverse individuals across different work places, different age groups, individuals who may have had symptoms, individuals who may not have had symptoms, because we've also learned that there is asymptomatic spread with this disease. We're learning a lot about COVID-19 as we go through this event. And the more we learn, the more we know that we have to make sure that we have the measures in place to stop the spread of this infection. It is highly contagious, but it can also be stopped. The chain of infection is broken when there's isolation and quarantine in place. The chain of infection is broken when there's social distancing in place that does not allow for the virus to spread from one person to another. The other information that's on this slide here shows how many calls we've had with regards to getting information out about COVID-19, either to schedule appointments for people to get tested or just answering questions. And you can see that there was a big spike around the 21st and the 22nd, and that was because we were having our testing in the community, which allowed for us to have more communication with individuals in the community about those testing events. We do plan to continue testing in our community. We will be reaching out with some of our community partners in our region, the health officers, as well as some of the emergency directors, to look at how we can work together across our 13 towns to address this issue and to slow the spread of COVID-19. We also have a plan in place to increase testing just locally with some of our community providers, such as the Soup Kitchen. And we'll be posting those dates and those times of when we will be offering those opportunities for individuals to get tested. Our goal is to, as we did on Wednesday and Thursday, schedule appointments and then have individuals meet with us at a designated location, which we will be posting on our website once we get the calendar set up. So we will try and have clinics at least every week going forward. The governor has a goal of getting 1,500 individuals tested every week, and we're going to work as hard as we can to help ensure that those numbers are met. Next slide. Okay, and this is a very interesting slide. Angela Luminello, she got married. Angela Costantino, our epidemiologist, included a slide here that lets us see the impact of social distancing by cell phone usage data. And what this is Google has developed a way of tracking where people use their phones. And this data has been made available so we could see where people are using their cell phones. And on this particular slide, it shows that in workplaces, there's been a decrease of over 38% in Hillsborough County and 37% decrease in New Hampshire as a result of social distancing and staying at home, right? And so we can see that individuals, that decrease in the workplace lets us know that social distancing or that stay at home is actually taking place. We can also see a decrease in 28% and 26% in Hillsborough and Nashua, New Hampshire, respectively, and grocery and in the pharmacy as well. And retail and recreation, decrease of 58% and 48%. What we do see is that there's been an increase of at least 55% in our parks in Hillsborough and 15% in New Hampshire. And this is as of April. So in January, this number is up higher than it would have been in January because the weather just didn't allow for folks to be out at that time. But then again, you can also see the impact with social distancing and being out in broader spaces where people are out and when they have gotten out over this period of time. At transit stations, you can see again, there's a decrease in the percentage of 39% and 57%, again, because of that social distancing and people staying at home. And so we know that these things are working. And residentially, you can see that there's been an increase in cell phone usage by 12% and 11% because people are at home. So we are actually very pleased that we have a large percentage of our population following the guidelines and following the recommendations that have been put in place with staying at home and maintaining their social distancing. We also see that in how the curve with this infection has been flattened for us in New Hampshire and in our county, and as well as in Nashua over the period of time that we've been involved with this particular event. We want to continue with those measures because we want to continue to have that impact in our cities, in our towns, in our state. As we continue to increase our testing across New Hampshire and across Nashua and our region, we may see an increase in the number of cases. Our goal, however, is to make sure that we don't see an increase in the number of fatalities as we do this. And in order for that to be maintained, we need to maintain our social distancing. We need to maintain staying at home. Next slide. Okay, so in conclusion, before Justin comes on, we're looking forward to our community continuing to engage with us in all of these efforts. It does take the village, and each and every one of us that makes up a part of this village has the power to help stop COVID-19 or coronavirus from spreading in our communities. Thank you. I believe Justin's going to talk about what we've been doing with our task force in the city.
Yes, thank you, Bobby. So to start us off, as a review, Justin Cates, Director of Emergency Management. I spoke last week around the task force concept that we had implemented within the city, and we wanted to provide an update on the 7 task forces that we put in place here within the city and give you some indication of where we're headed. So Bobby gave a great overview of the Public Health Response Task Force and some of the work that they've been doing, but we wanted to go through what some of the other ones have been doing. So first, the Municipal Continuity Task Force. As the mayor had mentioned, there's been a great amount of efforts on looking at what reopening our municipal operations would look like. The challenges that we're currently dealing with is that there are many public health actions that really need to be in place prior to us looking to reopen those municipal services. Our city divisions have done a great job at identifying creative ways for them to provide those services. You'll see out there today public works crews doing work out in the community, but they're using physical distancing. They have their cloth masks on. They're finding ways to keep themselves safe while they're performing that work. It's more challenging, though, for some divisions. You think about motor vehicle registration as an example. That's not something that provides us with a lot of opportunity for physical distancing. So in those cases, we're looking for creative technology solutions for us to be able to provide services better and more efficient in the future. So, I want to reiterate that we aren't going to be reopening anytime in the near future for our municipal operations, but you will continue to see improvements and efficiencies in the way that we're able to provide services in the interim while we're planning for those approaches that we can use to get services back up and running. We have started locally within the city a planning for our reconstitution, or otherwise known as the process for getting services back up and running. And we do have a meeting on Monday scheduled with all the division directors. And one of the things that we're doing as part of that review is getting a better understanding of the status of our employees, the risk factors within their workspaces. How often do they come in contact with other employees or customers? How easily do we have the ability to provide physical distancing for them in their workspaces? And how long can we have them work remotely to be able to keep them as safe as possible? And each week we do get a division update as part of our weekly briefings where each of the division directors give us an update as to challenges they're dealing with in being able to provide citywide services, but also things that we can do to assist them in providing those services. And one of the best examples that we've seen is some of the work that's being done with the building safety department on their virtual building inspections. That's the type of creative thinking that our division leadership has been taking with their staff to be able to provide services to the community. The mayor had talked about the community distribution task force, some of the work that's been done with meals distribution, But I did want to add on that planning right now is focused around summer feeding programs because that is something that we're thinking might be an opportunity for us to expand a lot of the work that's being done with the grab and go meals and partner with some of the community nonprofits to make that a reality. The Homeless Support Task Force has done a lot of great work with Nashua Soup Kitchen and Shelter to look at ways to develop a process for COVID positive clients to be able to get to a location that won't potentially expose the rest of the shelter occupants. So that's been a process that our welfare officer and Homeless Support Task Force leader, Bob Mack, has been working on with the Soup Kitchen and Shelter. There's also additional efforts right now with many of the community nonprofits to relocate clients into apartments when possible using emergency solution grants. And that's a way to also help reduce the amount of people that are within those shelters. The Child Care Task Force has continued to keep track of the status of child care facilities within the city, especially as discussions around reopening continue to be a very hot topic. But they're also looking at the status of summer camp programs and identifying any assistance that's really needed in preparation for reopening those types of programs in the community. Again, there's a lot of efforts that would have to take place in order to make that a reality, but they are trying to be proactive and think about ways that services can be provided to the community. And then I think the last thing I wanted to mention before we turn it over to Dr. Mosley to talk about the school task force is the Economic Recovery Task Force. You heard from Tim last week, Tim Cummings, our Economic Recovery Task Force leader, who's focused around looking at the economic recovery strategy for the city. And there's been a lot of work with many great partners, including Nashua Regional Planning Commission, the Greater Nashua Chamber of Commerce, and many others on putting together this economic recovery strategy that aligns with the governor's reopening task force. Mayor had also mentioned the COVID-19 Impact Fund, which is currently going through the process for full approval. But I think that'll be a great opportunity for businesses and nonprofits who are looking to try and continue their operations during this challenging time. On the next slide, I do want to make sure that everybody's familiar with our Business and Service Status Reporter. And the Business and Service Status Reporter is a tool that is open for our businesses as well as our nonprofits that provide services within the community, so that they can update the information about the status of their business or their nonprofit, the hours, whether they're performing virtual services or not. This is a crowdsourced application that anybody can go up to update their information. You'll see on here on the next slide, we've actually set up a dashboard where we can get an indication of how many businesses are closed, how many businesses are working virtually, and we would hope that you would put your information on here as well. It helps us when we're planning for community recovery, but it also helps our other residents and businesses understand what other services are available in the community. The URL, the link to access this tool is nashuanh.gov/BSSR. And that'll take you directly to that tool so that you can go ahead and add your business or add your organization to the map. And again, these are free resources for our community to use, and they'll continue to become more popular solutions for people to use to figure out what's going on within the community. I'm going to turn it over to Dr. Mosley at this point to talk about the efforts that the school district has been doing during this crisis.
Good afternoon, Nashua. How you doing? I know it's been a little difficult out there with the state shelter in place and helping our kids with remote learning. I apologize if you saw me going back and forth. I think a nice quick story here before we jump in is that I can actually hear Netflix booming downstairs, and I'm texting my kids to tell them to turn the television down. Despite my efforts, I'm thinking, do I get up and do I go downstairs and read them the riot act, or do I sit here and try to play it cool? Either way, I apologize if you hear background noise. Those are my kids, and I think that's a great segue to say, I kind of know how you feel, parents. I know that this has been very, very difficult for all of us. And I say all of us, as the mayor and Bobby and Justin has indicated, it's definitely been a team effort. So a couple of things as we start to come to the end of the year. Part of what has happened when we transition from our normal routine from school is to really develop what we call virtual meetings. And we have been doing some virtual meetings as a central office. Also at the building level, and these meetings take place daily. Daily. So a couple of things that I just wanted to share with you is that I participate in our CFO, Dan Donovan, also participates in the citywide meetings that occur every single day, Monday through Sunday. We also make sure that we meet as a central office 3 days a week to keep a pulse on what's going on, but also to implement things as well. And we also have our principals meeting with, my assistant superintendents meeting with principals to make sure that our remote learning is taking place, but also getting some guidance around that. I would be remiss if I didn't want to say just thank you to the community, thank you to central office, thank you to our teachers. Listen, our teachers, I would say that we can focus on the negative, but I would say our teachers, our educators, our custodians, our plant off staff, for those, the custodians, I know you don't like me to say custodians, so I'll say plant off staff members. You've done wonderful work just with our kids, and just the creativity out there has just been amazing. Yes, I see everything on Twitter. Yes, I see everything out on YouTube, and you guys have just been just phenomenal. And the teachers have been phenomenal, and the parents, thank you for your patience. I've been in education all of my life, and I am sometimes my patience with my own 3 kids can be wearing as well. So I understand. When I say I understand, I completely understand what you mean. A couple of things that I just want to share out with the public. Just a reminder, on April 27th is our vacation day. That's a day where we will be essentially closing down the district for our kids and for our faculty to have a well-deserved break. And we will be reopening on April 28th. Many thanks to our parents, administrators for all they're doing with remote learning. Earlier, the mayor mentioned United Way partnering with our schools to make sure that we are providing lunch for our kids. I want to personally thank the food service workers, United Way volunteers, Dalia Dago, our food service director, who has just gone above and beyond to make sure that all of our kids have something to eat. And even despite having this day off, we're still going to serve lunch on that Monday as well. I also wanted to personally thank our technology committee for all of their committee and members for all of the work that they have done. They've adjusted, adapted during this time, as we have seen an increase in technology and the need for that as well. When we first started this journey of remote learning, we immediately shifted to providing laptops for those students and families that needed them. And our technology department, led by Greg Rodriguez, really stepped up and made sure that that happened. So I just really wanted to say thank you. Thank you to Bobby Bagley. Thank you to Justin, the mayor. Great leadership on this endeavor. It's never easy, but certainly having a plan and then adapting, and it's just been phenomenal. And the partnership has been great. A couple of things about learning at home, remote learning. I would just like to say a couple of things. First of all, let's breathe. It's going to be okay. The second thing I just like to say to our folks who are watching this is the best thing to do is just develop a routine that works for your child, but also a routine that works for you. Our schedule is such that we're not asking any parent or student to sit in front of a computer for 8 hours and just do work. That's not feasible. We're asking people to follow. We have some recommendations in terms of an ideal schedule on our website to engage in remote learning in the morning, and then in the afternoon, develop some structure in terms of taking some physical activity. That could be a walk around the neighborhood or walk around the house. When the warm weather comes about, I'm sure cutting the grass wouldn't be a bad activity as well. Anything to get what I say, the muscles, the mind, and the body and the blood moving. That's very, very important. Routines are not a bad thing. They keep you going. The other thing that I think it's important for our community to know is that all of our teachers and administrators are here to help. If you have a question, please reach out to the building principal, and the building principal would be more than happy to give you the guidance, support, and resources to make sure that your question concerns are addressed and answered. As we think of some big ticket items, I just wanted to kind of put some things out there to the public. But now you've heard our graduation is going to be what we call virtual. Now, it is not the ideal situation. We get it. We understand it. Listen, I've said it in my letter. I also said it in the video, but I'll say it again here on Facebook Live. I completely understand how our seniors and our families feel about this day. It's a special day, and I promise we're going to have the graduation, but we're not going to do it in a way that endangers students, participants, attendees, or anyone who's connected to that. We have to keep in mind that when putting on graduation, it is a prodigious undertaking. It requires a lot of hours and manpower and people coming together, and we don't want to violate any of the recommendations coming from the CDC, and also coming from the governor's office and from public health as well. And practicing social spacing or social distancing is paramount. As soon as we get the clear in terms of making sure that we can facilitate graduations, we will certainly make sure we plan that. However, in the meantime, the virtual graduation is also a way of us to acknowledge in a way that our students have completed something. And we really appreciate all of those kids who are graduating in the year 2020. Our principals have already started reaching out. Keith Richard from the South and Nate Burns from the North have already started to reach out and get that information out to our parents and to our kids. We needed to make the announcement early now, only because it's going to take close to a month to get all that data, all that information back, organized, and presented in a way that is appropriate and recognizes all of the accomplishments for the class of 2020. We're also working with our middle schools to make sure that we put something together for our what we call promotional ceremony. It's not a graduation. Graduation only happens once. We promote students who go to our high schools. So we're putting together at Elm Middle School and that's my email. I apologize. That's just my email over there. We're putting together a promotional ceremony for our kids, 8th graders who are moving on to our high schools. That will be forthcoming in a couple of weeks for Elm Street, Fairgrounds Middle, in Pennachuck. We're also, believe it or not, we're conducting a virtual job fair for anyone who's interested in coming and working in the Nashua Public Schools. Please go to our website. Check out our human resource openings. I know we have some difficult times right now, but we still have to continue with the business of the district moving forward. And so we're definitely making sure that we are hiring, and we do have some vacancies coming up next year for anyone who's interested in becoming an employee or a teacher here at Nashua. So those things are actually working out really well. The last thing I'd like to just share, and this is my first time on Facebook Live, so forgive me if I don't know the format. When you do something live, it means people can ask you questions or you just keep talking. So I'll just keep talking for a little bit and then I'll be quiet. The last day of school will be Monday, June 15th. We have slated for our schedule for the last day of school. It feels like an eternity, but we'll get there. We'll get there. Part of what I would say is, it's easy to get negative. It's easy to focus on the negative. It's easy to get a little cranky when you're with your family members for a long time. Totally get it. I love my family too. I'm not just saying it's a bad thing. I'm just saying I understand. But the most important thing is that once this weather breaks, once this all kind of clears up, we'll get back to what we used to be, but it's going to take time. And what I mean by take time is that we need your help to be responsible. We need your help to continue practice social distancing. We need your help to not only practice social distancing, but also have the practices when you do go out. For instance, making sure you wear a mask. For instance, making sure you wear gloves. For instance, even what I do is when I have to go out shopping, I make sure that I have what I call my COVID-19 clothes. That means I wear one set of clothes, I go out, I do my shopping with those clothes, I come in, I don't make sure I bring those clothes back in, I put them in the garage, I put them outside, and then we do a sterilization in terms of cleaning. Those little things keep not just you, your family safe, but it keeps all of us safe. So I just want to put that out there and thank you. That help? Nicole, is that?
All right. Well, thank you very much, Dr. Mosley. And before we conclude, I wanted to talk about the need for you to to try to combat this cabin fever, which we all know everybody is having. The kind of staying at home is difficult at times. Dr. Mosley has spoken to that, of course. In order to stay healthy, you need to get out and exercise. And what I'm asking you to do is I'm committing to my wife and I that we're going to get out and walk a couple miles at least 4 times this coming week. I suggest that you join us in that challenge and do the same thing. But if not that, get out to our parks, get out to Greeley Park, Mine Falls Park, get out and get some exercise and get stimulated that way. It will help with the cabin fever. But as you've already heard, keep on the social distancing, the physical distancing. Stay 6 feet apart from everyone. If you go out, make sure you wash your hands. When you get back, make sure you wear a mask, wear gloves if you're going to be in a supermarket or something. Just continue to exercise all of these practices, which will help contain the spread of the virus. So again, thank you very much, and we will be back to you in another week or so.
Were there questions?
Okay, all right,
Any
thank
questions?
you, Mayor. Yeah, we'll take some questions from the press now. Let's see, I guess maybe have some new reporters on this week, so maybe we can start with one of them. Sarah from NHPR, do you want to start?
Sure. Sorry, I'm just unmuting. Can you guys hear me okay?
Yes.
Okay. Great. This is for Mrs. Bagley. We're just curious after the statistics that were recently released by DHHS showing a disproportionate effect of the virus on people of color, whether or not there's any guidance you're receiving from the state about how to work with these communities, particularly if they are if their first language is something other than English, and what role the public health department should be playing in reaching out to communities of color and immigrant communities.
Thank you, Sarah. So yes, I did see the information that was put up by the state, and I thought that was well done, and it was information that we actually need to see throughout our state with regards to all of our populations, and making sure that testing is available. And so the state is, because we have the opportunity now with the increased number of testing supplies that are being made available across the state, there'll be an opportunity for more individuals to get tested. Part of what we want to be able to do is if we can target testing in particular areas of the cities or in the places where we have the largest number of diverse population groups, and then making sure that those individuals have access to testing, that's going to help and close the gap in those disparities. And so we're planning to make sure that we can offer testing following the Civil Rights Act that says that, you want to make sure that one is accessible to people. If there's any transportation issues, you want to make sure that you get that covered. You want to make sure that the testing and the opportunity is available in population groups that may have difficulty because of transportation, because of language barriers as well. And we also want to make sure that we can help people understand or dismiss some of the stigma that's related to some of the trust that may not be there when public health or there are things that are put out by government officials because of past history. And I think that we in New Hampshire have been doing a pretty good job with making sure that we communicate information that allows for people to understand that the things that we're doing are to benefit our community by making them accessible and having the information that describes what's happening and why we're doing the things that we're doing. So I think if we can do those measures across the state, that will help close some of the gaps. And by increasing testing and making it available to all of our members in our communities will help close some of those gaps as well.
Thank you.
All right. Sarah, did you have anything else, or are you all set?
I do have another question, if you're willing. Yeah. Can you hear me?
Yes.
Sure. Why don't
Okay.
you ask your second question, and then we'll go to Dan and Adam after.
Great. Okay. This is for Mayor Donches. Yesterday, we heard in the press conference Governor Sununu saying that federal relief money can't go to states and cities experiencing a drop in revenue. And I'm curious what you guys are expecting this fiscal year to look like in terms of a drop in revenue or in deficits.
Well, we're very disappointed that there are certain people in Congress who don't want to see the state and local governments get any money, any direct assistance with loss of revenue, because we definitely are going to lose revenue. For example, the cities and towns in New Hampshire are reliant upon automobile registrations for part of their income, and to the extent that money doesn't come in, that might be offset by property taxes. We're also we do get a small portion of the rooms and meals tax. There, we're likely to suffer a decline as well. The people in Congress, and I've been talking to our congressional delegation about this, our congressional delegation understands and is trying to fight for the local communities, but there are others in Congress who don't believe that the local communities can get any help. But we do need it. It would be of great assistance, and I will continue to talk with Senators Shaheen and Assen, and in our case, Congresswoman Custer, to do anything possible to change Congress with respect to the direct assistance.
And is the city seeing an increase in people seeking deferrals for payment of property taxes, either homeowners or businesses?
That wouldn't happen yet, but we expect that may occur in the future.
Okay, thank you.
Okay, great. Thank you, Sarah. I was going to go to Dan Tui next, but I think he dropped off the call. So Adam, do you have anything?
Yes. Can you hear me all right?
Yep, we can hear you.
Excellent. Yeah, I just wanted to circle back to something that Mayor Donches said early on in today's press conference with the CDC enabling the city to hire 4 additional employees. I was curious what the name of that foundation was and what those 4 additional employees will be doing specifically.
The organization is called the Center for Disease Control Foundation. So, of course, you're familiar with
I thought
the
you said there was a
Center.
nonprofit arm of that. Maybe I was confused.
Foundation is a nonprofit which raises money privately. So they work with the CDC, but it is a separate organization that raises money privately, a nonprofit company, a nonprofit corporation, nonprofit organization. So they are going to be paying for us to have 4 employees. We expect that one of them will work with emergency management. They've designated one as an information person, helping to educate the public about what's going on. And 2 people would work directly with public health and our public health nurses. So I'm very excited that we have the opportunity to work with the CDC Foundation to get this extra help here in Nashua, because we want every resource we can get to help us and our public health department and emergency management help us to contain the COVID-19 virus.
Thank you.
And Mayor, if I might add,
Yes.
so the foundation, Adam, is actually, as the mayor said, is the Center for Disease Foundation. And what it was this TikTok. Have you heard of TikTok? The mobile video platform. During Public Health Week, they actually did some fundraising, and they gathered about $15 million that they donated to help support frontline public health workers. And so that's where that funding source is coming through to the CDC Foundation to support the efforts that need to be supported for this response to COVID-19. So across the nation, a request went out to ask, who needs support with this work. And we responded and heard from the CDC Foundation very quickly. And they asked, what did we need here? And so we put forth a request for the 2 public health nurses, the communication specialist, and support through emergency management, which is a great opportunity for us here in New Hampshire.
Definitely. And then, if I may, I have one more question for Bobby as well. I believe you said that the division's going to be trying to have clinics every week going forward. Is that going to begin as of next week, or when do you hope to begin that?
So we are hoping, Adam, to begin that next week. We have plans to do a clinic with the Nashua Soup Kitchen. There were, as we rolled out the opportunity for this increased testing during this week, we learned that there were individuals who could not go through a drive-through mobile clinic because they didn't have cars. And again, you want to make sure that you can make testing available, to everyone in the community that wants to be tested, and also to give us a really good idea of what the disease burden looks like in our city. And so, Sarah asked about how do we, get rid of some of these disparities. The way to do that is make sure that we can make things accessible to everyone in our population groups. And so by doing these clinics every week, in addition to what the state will be doing with their multi-state mobile response services and the van that's going to go around, the increased clinic opportunities through Convenient MD, we're playing our part by offering more community testing right within Nashua and making sure that individuals who either don't have cars, don't have primary care providers, may not have insurance, may not have access to a provider who can make a recommendation for them to get tested, we can offer those tests in our community. And so we will be setting those opportunities up. They will be by appointment only. Individuals will need to call our COVID hotline at 589-3456 to make appointments. And as I mentioned earlier, once we get that schedule put together, we will post that on our website, and that phone number will be posted as well. We'll also be partnering, Adam, with some of our community-based organizations to see if we can set up some on-site testing on their particular, at their sites as well. As broad as we can do this, we're going to do it as long as we have the supplies to. A large number of testing supplies came into the state, and we're expecting to capitalize on those resources and test as widely and as broadly as we can.
Great. Thank you.
You're welcome.
Okay. Are you all set, Adam? Do you have anything else? Or Sarah?
I should be all
anything
set right now.
Okay. Sarah, are you all set? Did you have anything else?
I'm all set, thanks.
Okay, perfect. Okay. All right.
Well, thank you all very much, and we'll see you soon.
Yeah, thank you.